Welcome back, everybody. February is Heart Health Month, and as we raise awareness that is all month long, we're now going to shine a light on a statistic that has cardiologists really sounding the alarm. Heart disease is now the #1 cause of death in pregnancy. Yeah. So we're joined now by cardiologist Haythe and her patient Merediths, who is a high-risk heart patient who successfully just gave birth. You have quite the story. I'm going to get to you in just a moment, Merediths, but let me start with you, Dr. Haythe. How did heart disease surpass hemorrhage as a leading cause of death in pregnant women?
Well, I think it's probably a twofold reason. One is I think OBGYNs have become really good at treating hemorrhage and understanding how to, follow bleeding and signs of bleeding. But also at the same time, the age of women having babies now has really increased. And when the average maternal age starts to go up, we start to see women have underlying risk factors for heart disease, like diabetes, hypertension, and obesity.
Right. So what risk factors should women really be in tune with?
So, all patients, all women, regardless of their age, should ask their doctor, do I have high blood pressure? Do I have diabetes? Is my cholesterol elevated? Is my thyroid normal? And then if you have a strong family history of heart disease, you should always tell your doctor. Or if you have a history of a heart murmur, if you've had prior heart surgery, all of congenital heart disease, a lot of our congenital patients are treated in infancy and now are growing up and having babies. So it's very important to talk to your OBGYN and your primary care about all of these things so you can be screened appropriately.
I see diabetes on there. I had gestational diabetes. Is that part of the diabetes, category, or is that prior to becoming pregnant?
Yeah, thank you for sharing that. Gestational diabetes is diabetes that develops during pregnancy. However, women who have gestational diabetes are at increased risk to develop diabetes later in life. So they need to really stay on top of that risk factor.
Okay. I want to bring in Merediths because Merediths, you're going to share some of your story with us, and it's really important for women to hear this. You actually were at high risk during your pregnancy. What happened?
So I was diagnosed with pulmonary hypertension secondary to an autoimmune condition called lupus. And that was 6 years ago. And I was told not to get pregnant until the pulmonary hypertension is more stable. So I was advised to take alternative forms of bearing a child. Fast forward last year, 2020, my husband and I found out we were pregnant. It was unexpected and unplanned, but a very much welcome surprise. So at that time, my OBGYN then reminded me to, about the high risk condition and the high mortality risk associated with pregnant women who have my diagnosis. So alternate options were discussed, but we decided to pursue with the pregnancy. So at that time, my high-risk OB doctor had referred me to see Dr. Haythe at Columbia for a cardiac consultation. And at that time, Dr. Haythe not only obtained my medical history, in addition, she had me do like a series of tests, including cardiac catheterization, echocardiograms, just to determine the extent of my pulmonary hypertension. And after the results were in, we found out that I have the mild degree of the disease.
Okay.
So she had recommended, she's like, you're okay to proceed with the pregnancy. But she emphasized the need for a very close monitoring during the entire course.
And you had a healthy pregnancy? Everything went okay?
It was okay, thankfully. Okay. So it went well, but I had to follow up at the Mother Center with my high-risk OB and Dr. Haythe, and Dr. Purish, like every 2 weeks. And that was pretty much the entire course of the pregnancy until I delivered.
Well, we are so happy to hear that it was a success story with you, but I think Merediths brings up some really good points there, especially not only with folks who have those underlying conditions, but Dr. Haythe, as you mentioned earlier, women are getting pregnant later in life, so that does put them in the high risk category. So talk to us about the Mothers at the Center at Columbia there and what you provide for those who are in that high risk category.
So the Mother Center at Columbia is a great program. Basically, it actually treats any pregnant woman with any underlying medical problem that requires more attention or more considered more high risk. It doesn't have to be just cardiology. However, we've launched the cardio-obstetric program specifically at the Mother Center because cardiac disease in pregnancy is so important. Led by myself and Dr. Stephanie Purish, we basically see all of these patients together in concert. even up to every 2 weeks. At some points, we were seeing Meredith every 2 weeks, screening them very carefully, monitoring to make sure that they can have a successful pregnancy.
And, you know, that really can be the difference between life or death, because a lot of people do experience these things toward the end of the pregnancy. One of the things on the list that we put up there was preeclampsia. I also had that during delivery. And so, I mean, there are a whole host of things, and it's wonderful that your office there and that center allows women the opportunity to get the help they need before it becomes a problem.
Definitely. Thank you so much for highlighting this important issue.
Absolutely. Take care to you both.